is a choice. Wellness is a choice. Talktainmentradio.com. We go where you go. The world's greatest radio. Radio the way it should be heard. And you're in touch with the wildness spot. And I'm Tank the nurse. Can you control diabetes? First, let me say we have the doctor in the room. So Dr. EMAD MISAK is with us today, and we are going to discuss diabetes. We will also have Dr. EMAD with us at the Wellness Spot on Tuesday, where we will have an informational meeting to go over how you can control diabetes. That's the question of today. Can you control diabetes? Diabetes causes cases have nearly doubled or tripled. Over 40 million people are diagnosed with diabetes. Somewhere around the number of 1.6 million adults every year being diagnosed with diabetes. Most 90% of those cases have to do with obesity. A lot of things we have found when it comes to diabetes, a large number in the southern states, but here in Ohio, we have over 15 million people diagnosed with diabetes. And my data is a little old, so I'm sure those numbers have increased when we talk about the number, at least 2 million worldwide diagnosed annually with diabetes. It's not a condition that you want to get because it's no fun. I know that personally by being diagnosed back when I was in my 40s. So it's not something that I think anyone with diabetes would say that they would wish on anybody. But we got Dr. EMAD here, and we want to get some answers to some wonderful questions. We want to get to see how can we find a solution. How can we control diabetes? How can we stop some of the effects of diabetes? So let's start with Dr. EMAD, and let's first get a definition of what is diabetes.
First, thank you a lot for having me. I'm really happy for being today with you in this program.
Thank you for being here.
Okay,
That's a
thank
lot
you.
to have the doctor in the house.
Thanks a lot. It's very important question. What is diabetes? Because many people don't know actually what is the normal range of blood sugar in our blood. And this is very important, and the number considered normal change from time to time.
Yes.
According to new studies, new research, it is different from time to time.
That is true.
According to the American Diabetes Association recommendation in 2016, blood sugar, fasting blood sugar, that means we are fasting from 6 to 8 hours, not more by the way.
Okay.
Fasting blood sugar should be not more than 125.
Okay.
If 126 or more, so you are diabetic.
Well, and that is a change because I think when I was diagnosed many years ago, it was anything over 120 fasting.
Exactly.
And like you said,
Exactly.
fasting is not having anything to eat for 6 to 8 hours. So typically when we wake up in the morning, if we were to do a finger stick
Exactly.
and our blood sugar was over 126 now,
Exactly.
we
Fasting,
would
the fasting.
fasting
Uh-huh.
without having anything in our mouth, we would be considered a diabetic
Yeah.
or a pre-diabetic.
That's what I'm gonna say.
Okay.
Pre-diabetic is a very important to define what's pre-diabetic, and this we can know it from postprandial blood sugar. What's postprandial? It's after meal.
Oh.
How is the number of our sugar after meal, and not just after ending the meal, not after half hour or 1 hour. The right thing is that to check blood sugar 2 hours after finishing the meal. Blood sugar from 140 to 200 milligram per deciliter 2 hours after meal is considered pre-diabetic.
Wow.
Yeah.
Okay.
More than 200 is diabetic. Pre-diabetic, this is very important. Why? because most of people in this range, pre-diabetic from 140 to 200 milligram in blood sugar, can be treated and controlled without any kind of medication.
Okay, so now that's pretty powerful.
Okay.
So let me see if I got that. So if 2 hours after eating, I test my blood sugar, and my blood sugar ranges between 140 and 200,
Yeah.
that is pre-diabetic.
Exactly.
If my blood sugar after 2 hours of eating is still over 200, then I'm a diabetic.
Exactly. Exactly.
But if I'm in the pre-diabetic stage,
Mhm.
I can watch what I eat and do things naturally and not have to take medication to control my diabetes.
Exactly. Exactly. By the way, even if you are diabetic and your blood sugar is more than 200, natural product help, of course, but most probably you will need medications, chemical medication with the natural product. But natural product, even if you are having blood sugar more than 200, will be of a big benefit to control diabetes without side effects and even prevent the complications of diabetes that may happen later with time. And we're
Okay.
going to speak about this again. But the pre-diabetic can be totally controlled without any kind of chemical medication, which of course can have side effects. How? I can tell you. There are general rules that we can take, and even if you are not diabetic, we should take care of this kind of measures to prevent being diabetic, having hypertension, having lipid profile high, or this kind of stuff that usually are interacted and coming with each other together. If you are obese, try to reduce weight.
Yes.
You can control your pre-diabetic stage and don't get into diabetic stage.
Right. Right. So you're saying there's some things that we can do
Exactly.
that help us overall with our general wellness.
Exactly.
Like I always say, wellness is a choice.
Exactly.
So if we choose
Mm-hmm.
to lower our weight,
Mm-hmm.
exercise,
Mhm.
it can help with diabetes, high
Mhm.
blood pressure,
Yeah.
and you said cholesterol,
Exactly.
because these can go together.
Exactly.
You can get one, and then the other two friends just tag along with
Exactly.
it.
Exactly.
Is that how we can
Something
do
in medicine known as X syndrome. X syndrome, that means that a patient may have diabetes, hypertension, dyslipidemia together. And by the way, a hypertensive patient who don't have diabetes are prone to be diabetic.
Ah.
So if you are diabetic or hypertensive, and if you are diabetic and you don't have hypertension or dyslipidemia, high cholesterol, you should take care to prevent having this kind of diseases, because when you are diabetic, you are more prone to be hypertensive and having dyslipidemia.
Yes, I guess I think of it as friends. If diabetes comes, it's going to call those other two friends to come right along.
You are exactly. You are
Okay,
exactly.
okay. So
You are
we do have to stay in that preventative state, or do the best we can to take care of ourselves,
Mhm.
thinking in a prevention way. Exercise, good water source, good nutrition,
Good. Yeah.
good supplements,
Mhm.
right?
Exactly.
And as a pre-diabetic, if we make those changes,
Mhm.
we can have good results.
Exactly.
Okay. So what causes diabetes? How I woke up at 40 and I
Mhm.
was a diabetic.
Very good question. Diabetic. There are two types of diabetes.
Okay.
Type 1 and type 2.
Okay.
Type 1 is a type, what make you having high blood sugar is that your body, the pancreas, which is a gland, secrete insulin. This is a hormone or a protein called insulin. And the insulin control your blood sugar and keep it within normal range even after eating high food with rich in sugars.
Okay. Okay.
Type 1, that means that the pancreas who secrete insulin had damage and no insulin secretion.
Okay.
And this is type 1. This type 1 cannot be controlled with natural product. You should have to take insulin from outside, either by injection or a pen. You take it as injection pen for insulin. And there is insulin pump. There is a kind of pump that one can fix it on its body and it is through direct contact with the skin, they reach the blood and tests the sugar and can control it by pushing insulin all of a sudden towards your blood according to the readings of how much your blood sugar is. If it's high, the pump increase the insulin. If the sugar try to be low, the pump stop the insulin. And there are also new researches that in the near future, I hope that there can be operation for pancreatic transplant. We can transplant pancreas, which is damaged in type 1 diabetic people. We can transplant it to work normal and control blood sugar without need of extra insulin. But also, type 1, you have to take insulin, but also if with type 1 we take natural product like essential oils or controlling your nutrition or micro daily, that's we're gonna talk about it later, mixture of vitamins and some minerals like chromium and zinc, this will help a lot in controlling even type 1 diabetes.
Right.
This type 1. Can I speak about type 2 or?
Yes,
okay.
yes. I just want to give a little review about type 1. So type 1,
sure,
a lot of times it's called juvenile diabetes.
Exactly.
Because they're born, or the person may be born with some type of a defect with the pancreas that is not allowing it to administer insulin that is needed to allow the sugar to get into the cells and give us that energy.
Exactly.
So we need carbohydrates, but we don't need as much as we take in. And we don't need it in the form of sugar and pastas and rices like that.
Exactly.
So this person with type 1, they're typically a juvenile diabetic or someone that has a pancreatic issue. Okay, now we get to that diabetes type 2. That's the one that is taking over the nation.
Exactly. But I want to say something about type 1.
Yes.
If you allow me.
Yes.
Type 1, what's the cause? It may be genetic, and it may be something that harms the pancreas. Something that harms the pancreas may be a gene that we are born with, and this cannot be prevented.
Right.
And there is disorder of immunity can happen and destroy the pancreas, and maybe this is not easy to prevent. But something that we can prevent, and that's what I want to say to all parents, is that if a child, a young child, has a fever, all of a sudden, you have 2 years or 3 years, she must go to doctor at once. Don't delay going to the doctor. Even take him to the emergency room directly. Why? Because some viruses in the children may affect the pancreas. And if not treated, all of a sudden, it may damage the pancreas, and the child will be diabetic and live all his life or her life as a diabetic patient and start to take insulin and to be injected while he's a child. This kind of diabetes can be prevented if the child who are having the fever get treated and control the fever all of a sudden without any kind of delay. This important point I want all the parents to take care of.
Okay. Well, that right there is what I call a golden nugget.
Yeah.
Because you're saying that we have to be careful when our children are in their toddler stages to have high fever.
Yeah.
We need to get them to the medical help so that they can find out to prevent that damage to the pancreas.
Exactly.
Understood. Understood.
Type 2, concerning type 2, the pancreas is not damaged. The pancreas secrete insulin. So what happened? What happened is that the insulin secreted by the pancreas cannot work well, cannot control the sugar well, which called insulin resistance.
Now, is that because we're taking in too much sugar that the insulin cannot control it, or is it something else going on that causes that insulin resistant?
Eating much carbohydrate and much sugar increase the condition of insulin resistance to happen, and then we can develop diabetes. And there are many other stuff that may lead to the condition of insulin resistance. When we eat much sugar, much carbohydrate, when we are obese, when we are lazy and living sedentary life without any kind of exercise.
Can I rewind?
Yeah.
You highlighted a point that can be controlled by everyone. Doesn't take that much,
Mm.
but we cannot have a sedentary lifestyle.
Sure.
We cannot just sit. We have to get up and do purposeful movement and move
sure,
our body.
Sure. Yeah.
Okay.
At least walking or hiking 30 minutes per day.
Yes.
And it's not everyone must take it as if it's like kind of regular schedule, as
Yes.
if you are eating, you are sleeping, so you have to walk.
Yes.
You have to
That is
exercise.
key.
Yeah.
That is key. I like the way you said that. I typically say you take that just like you would take your medicine.
Exactly.
You cannot let anything derail you from
Mm.
that 30-minute workout.
Yeah.
Has to be a daily thing.
Exactly.
And it doesn't have to be a 4-mile run, but if
Mm.
that's what you choose, then that's so be it. But at least walking, doing something that is purposeful movement, getting the heart rate up, doing some exercise.
Exactly. And
Okay.
there are many kind of medical hazards that may lead to diabetes if you have a disorder in your thyroid gland.
Okay.
There's a gland here who secrete hormones. If this hormone is highly in your blood, this may lead to diabetes.
Okay.
And there is a gland, suprarenal gland above our kidney, secrete hormone cortisol. Sometimes there is abnormal excessive secretion of this hormone, and this may lead to diabetes. I'm saying that because some people may be diabetic, and they should be checked for thyroid gland and suprarenal gland. Because if any kind of trouble in this gland, and if it can be controlled, diabetes may go away, may be controlled.
Now that's another
it's
golden
not,
nugget.
yeah, but it's not very common. But I like to say it to make people take care of it.
Right, because the
Focus on it.
thyroid is very important.
Mhm.
It secretes a lot of hormones and the adrenal glands,
Mhm,
like you said, the cortisol.
Mhm.
And we do not need to be in fear and in flight all the time. So that also is a big contributing factor to obesity,
Exactly. Sure.
which
sure.
is goes hand in hand with diabetes.
And stress also. Stress also, cortisol, increased cortisol related to stress, and stress can lead to diabetes or can help or can ease that a pre-diabetic patient go to diabetes. So we should control stress, we should control cortisol if it's high in high level in our blood.
Well, let me see if I got this right, because the way I sometimes explain this, you know, when we stay in fear and in flight, and our adrenals, our cortisol and our adrenaline is used when we are in fear and in danger,
Exactly.
because it will suppress the digestive. It'll give us increase the heart rate, give us energy for our legs to run.
Exactly.
So when that happens on a constant basis, that increases weight,
Exactly.
increases abdominal weight,
Exactly.
messes with our hormones.
Mhm.
And then if we have thyroid problems that are also affecting our hormones, then, and you add to that, I don't like to exercise, and maybe I eat a lot of carbohydrates, drink a lot of sugary drinks, or have sugar as my best friend, I'm creating insulin resistance in my body and setting myself up for diabetes. So it's safe to say that if I can change some of those lifestyle things, and I can get moving, and I can watch what I put in my mouth, and I can turn off those adrenals and get those hormones in balance, and use some natural products, I can get myself feeling pretty good.
Yeah. By the way, you summarize and organize what I say in a perfect way.
Well, thank you. You know, I had to put on my stethoscope today. I had to look like the nurse today. Not the tank nurse, but the nurse. Everybody don't want to see the tank nurse. So, with that, what are some symptoms of diabetes? Because some people, like you said, they continue in that lifestyle and they miss some of the warning signs.
Yeah. It's very important questions because some people don't have any kind of symptoms. Some people have symptoms, but they can neglect it. Say it's something, it's nothing, it's not important. And if they're gonna neglect it, they may all of a sudden have been exposed to complication of diabetes.
Yes.
Without being diagnosed and knowing that they are diabetic.
That's
if
right.
they don't do regular checkup. But the classic symptoms of diabetes is that we want to drink a lot of water. never feeling you are enough of water, increased thirst sensation.
So me, I love water, so I
Mhm.
tell people drink, drink, drink. But if you have excessive thirst and never satisfied,
Exactly. This
okay,
may be due to diabetes.
all right,
Increase appetite. You want to eat any kind of you see in front of you want to eat, increase appetite. This may be due to diabetes, especially if we eat a lot and we lose weight at the
okay,
same time. And also, the very common symptom, frequency of micturition, frequency of peeing, going, especially at night. One diabetic may wake up at night, going to the bathroom to micturate 5 or 6 times every
Okay.
half hour or
Right.
every hour. And
Right.
this is hurt, it's very harmful. But sometimes all the symptoms are absent, especially in type 2, which we want to focus on type 2 because this is type 2 which is very common in the United States and which is the type that can get benefit more with our natural products.
yes, yes. So natural products to me are a great adjunct, I think, with anything, but definitely when it comes to diabetes. But just to review, some frequent
Yeah.
excessive thirst,
Mhm.
always thirsty, always trying to satisfy that thirst, hunger, excessive wanting to eat, not even hungry, just wanting to eat and not gaining weight.
Exactly.
Okay, and then excessive urination, especially at night. And I would say, I recall when I was in Germany, a parent brought her son in, and that was her complaint. He could never get enough to drink, and he was always every 20 minutes going to the bathroom.
Exactly.
And those were classic signs. He was what we call textbook.
Exactly. And please, I want to add something as a symptom not of high blood sugar, but of hypoglycemia or low blood sugar. Because many diabetic people under treatment may have all of a sudden decrease of our blood sugar, of
Yes,
their blood
yes.
sugar. And this is very important because decreasing blood sugar below 50 or 60 milligram per deciliter may have a damage to the brain if it's not controlled all of a sudden. It's very
Okay.
easy to be controlled. But what kind of symptom diabetic people, if they suffer or have, may think that they have low blood sugar, is that if you have palpitation, heart beats a lot, excessive sweating, tremors in your hands, this may be a sign of decreased blood sugar. And
Okay.
it can be easily controlled by taking a candy, piece of chocolate, or any kind of sweet stuff.
But and I laugh because there were times when I call it not hungry, hangry, where have the jitters, a little irritable, maybe a lot irritable, not just a little, a lot irritable, sweating, and the heart palpitations, and need sugar to get everything together, or need to
Exactly.
put something. So that's very good to know.
Mhm.
So the person can go both sides. Now, a little bit about complications.
This is very important issue, by the way, because many people who are diabetic and maybe they are not complaining of any kind of complaint and they neglect treatment.
Right.
And all of a sudden had been facing damage, complications that is irreversible.
Irreversible.
Yeah.
Yes.
Most common complication of diabetes, actually it has complication if not treated properly all over our systems. It can affect the heart. It may lead to angina, chest pain, myocardial infarction, thrombus in the heart, which some people need a bypass operation. It may increase your tendency to have infection, rather on our skin or in the lung, for example. You can easily have pneumonia, especially if you are in your old age. If diabetic in old age and taking a kind of flu, common cold, it may easily turn to pneumonia as long as he's not controlling his blood sugar level.
Wow.
It may affect the kidney, and this is very important because if the kidney had been affected, this may lead to renal failure and you go through dialysis and maybe we need a renal transplant. And by the way, there are investigations that can we do for kidney to detect that is totally free, or even detect that they are started to complain. Maybe many people know about urea,
Yes.
creatinine, and uric acid. But there is a test that may show that the kidney is starting to suffer. And this is a reversible stage, by the way.
Okay.
If we detect it, we can stop it and restore our normal function of the kidney. A test, maybe I want to say its name, is estimated glomerular filtration rate.
Yes.
Yeah. And another test, 24-hour microalbuminuria. If we test the microalbumin for collecting urine for 24 hours, and there's increased microalbuminuria or abnormal estimated glomerular filtration rate, that means that the kidney started to suffer. And
Yes.
this can be controlled and get your kidney back to the normal with very little manipulation, very little diet control, and very little medication. Also, I want to say about complication, the retina is very important.
Yes.
The eye, because diabetic people, if not controlling their diabetes, the retina start to suffer, and they may, at the end, they may lose their vision. They may be turned to blind. And there is very important thing that diabetic people should take care of. They should make eye examination
Yes.
once per year.
Right.
Why? Because sometimes the eye examination start like black spots on our retina. Why the patient did not start to suffer. No suffer at all, no complaint at all. The ophthalmologist and the eye surgeon, when they notice the beginning of black spots on the retina, patient don't need the surgery. It can be treated by kind of laser, and the retina return back to the normal.
Okay.
But if we neglect examination, regular examination for our eye, and we are diabetic, we may all of a sudden exposed to big damage to our retina, and this to a stage that can be irreversible. But when we do regular checkup, we can check any kind of black spots in the beginning, and we can treat it well.
And I have to say something with you saying that, because a lot of people, I'm always talking choose wellness, choose life, and talking the natural, but we have to go and get a checkup. And like you said, we have to check our eyes annually, especially if we know that we have diabetes or pre-diabetic. And you mentioned checking your blood work to check the function of the kidneys.
Exactly.
And annually, you should check your urine. So, one of the things that I've said a lot this past week, we cannot judge our health by how we feel,
Sure.
nor how we look.
Exactly.
And I think it's a big mistake in the United States that a lot of people judge their health by beauty, by size, and by how they feel. And those three are not good indicators of if you are well.
Exactly. Sometimes what we have inside don't be reflected outside. You may
That's
look
right.
outside in a perfect shape, and inside troubles and harm starting.
Yes.
So regular checkup is very important to control things from the beginning.
So when we come back, we're going to find out how can we win with diabetes.
I think we're gonna win, and
We're
we
gonna
can
win.
win it.
Yes.
Girlfriend, why are you in such a good mood on a Monday morning?
We just bought a foreclosed home and saved a ton of money.
A ton of money? What a blessing. Tell me how.
Well, Linco Realty specializes in selling foreclosed homes.
Linco Realty? I've heard about them on the radio. Yeah, that smart people buy foreclosed homes ad. Don't they have that website with all those vacant government and bank-owned foreclosed homes?
Yes, that's repohomelist.com. And they have lenders with purchase and repair money, even down payment assistance, and credit repair.
No money down, plus purchase and repair money? What's the number?
614-375-2289. Record low interest rates make some homes cheaper than rent.
Well, Bill wants a new home. Can Linco Realty help us?
Yes, Linco Realty can sell you a new home in over 50 communities around Central Ohio. They've been in business for over 35 years.
Wow, you've really been blessed.
Yes, we have, and you can too. Call Lincoln Realty today at 614-375-2289.
For the best home fragrance and beauty products, shop Ash Kickin' online.
That's ASHKICKIN.
Made with 100% natural quality ingredients and handcrafted with your family in mind, Ash Kickin' products are better than those other guys. Ash Kickin' candles, incense, body butter, face moisturizer, and hair moisturizer are priced just right, and you can get yours at 10% off with coupon code TALK17. Support this 100% black-owned business and get your home and body smelling and feeling all right.
That's ASHKICKIN.
Shop Ash Kickin' online at www.ashkickin.com.
Are you ready for a high school that allows you to work at a place that is right for you? Are you ready to earn a certification in healthcare, business, or manufacturing while achieving your high school diploma? Then you are ready for Life Skills High School, a free public school option for high school students 16 to 21 years old. Learn more about your free high school educational options at lifeskillshs.org or call them at 1-800-888-7992. Life Skills High School, education that fits your life.
I've got the water, energy bars, and camera. I think we're set for the hike.
Almost. We need to protect our skin. Don't forget your wide-brimmed hat and sunscreen.
All right. I've got the hat. I've got SPF 30. Will that work?
Yeah, anything 15 or higher is good. Just make sure it says broad spectrum.
Great. Got it. I am not getting burned again. Let's go.
Learn more at cdc.gov/cancer.
This is Al Edmondson, owner of a Cutter Brother Rest Barbershop. I'm calling on all barbers and beauticians. It's time for us to unite as one. We can serve our communities better together. Join the Ohio Black Barber Beauty Network. For more information, visit www.obbn.org or call 614-427-3226 to get more information. Be the change that you want to see in your community. Join our network.
If you or someone you know is abusing drugs and/or alcohol and want to stop the abuse, contact APDS at 1409 East Livingston Avenue. Office hours are 9 a.m. to 8 p.m. daily and 9 a.m. to 3 p.m. on Saturday. APDS is certified by the Ohio Department of Mental Health and Addiction Services and primarily funded through the Adam H. Board. Fees are based on your income and Medicaid is always accepted. For more information, call 614-253-4448.
Every year, June marks the beginning of two busy seasons, summer and wedding season. If you are legally changing your name, you need to apply for a replacement Social Security card reflecting your new name. This is easier to fix now when you first change your name than years from now when you retire. So go to our website at www.socialsecurity.gov/SS number or call us at 1-800-772-1213, TTY 1-800-325-0778 to find out what specific documents you need to change your name and apply for a replacement card.
Live call-in talk show. Dial 1-877-932-9766 and join the conversation here on TalkTimidRadio.com.
TalkTimidRadio.com. We go where you go. The world's greatest radio. Radio the way it should be heard. And we're here with Dr. EMAD. The doctor is in the station. I was going to say in the house. You see, I put my stethoscope on. I put my jacket on. I said, okay, I got to look like a nurse. But a nurse needs a great doctor. And we got a great doctor with us today talking about diabetes. Our last time we were together, we talked about hypertension and trying to help people understand, like you mentioned earlier, they're three twins. They're like the three amigos: diabetes, hypertension, and high cholesterol. And the great thing is they can be prevented, they can be controlled, and you know, I don't know, Dr. EMAD, I'm not sure if you knew this, but last year I lost a cousin to heart disease, and I was very frustrated because he didn't go see the doctor, he didn't want to take his medicine, but he didn't do natural either. So he didn't do either. And that's where I think, as a nurse, I want to reach people. Yes, I believe in natural products. I believe in changing what we eat. I believe in exercising. I'm ready to ride my bike. The weather was so good today. And I believe in modifying what we do. I was just this weekend with Willoughby, Soul Food Vegan, out at the Upper Cup. And we had a wonderful time. But if you're not going to make these changes, you have to follow the doctor. You have to follow the doctor's orders. You have to take your medication. You have to go get checkups. You have to do those things that help us to stay well. Now, if you're, you know, and that's what we want to talk about right now is how can you win with diabetes? What can we take? What changes can we make? Because I recently talked to some ladies that feel very fatigued. You know, their blood sugars are high. Now, what I consider high and what you consider high is 120 and over 150. But, you know, some people are walking around and don't understand the importance of having a blood sugar over 200, even 300, 400. So what's considered high that we need to start making some changes and take it serious? What's that number that makes you say, no, that's too high?
As I told you, pre-diabetic is from 140 to 200.
Yes.
More than 200, it's diabetes. But as long as we neglect our blood sugar and don't treat it and keep higher and higher and higher, as long as it's high level, it's more dangerous.
Yes.
So 300 is more dangerous than 200, and 400 is more dangerous. If we leave it high and high and high, it's more liable to have complication very soon.
Yes.
For example, if you can control your blood sugar, you will not suffer from complications.
Right.
But if you have it 250, for example, you may develop complication after 10 years. If you have 300, you will develop complication after 5 years. 400, maybe after a year.
Yes.
So you should control your blood pressure as normal as we can, as normal as it should be, okay?
Right.
And don't neglect it.
Right.
This high, 400 is very high, 300 is very high.
Right.
From 200 to 300 is high, but can be easily put under control.
Right.
But more than 300, it's horrible. And all of a sudden, patient may get into coma and he may die. Because in Egypt, I checked many patients, diabetic, and they neglect their treatment. And all of a sudden, blood sugar reaches 300 and they get into coma. And their surrounding people don't know what to do, and they cannot save them. And all of a sudden they get into coma and that's brain damage.
Right.
A
And
state is called diabetic ketoacidosis.
Diabetic ketoacidosis.
Yeah.
Now, you said a word in there, I don't know if everybody caught it, but you said horrible.
Yeah.
And that is true. And I think that, you know, diabetes can be depressing. It can be very frustrating because, especially in the United States, we love to eat, and we are in a nation where processed food is big portions. So portion control is very difficult. Typically, what I do and what I recommend is when you go to the restaurant, go ahead and get the to-go bag or the doggy bag or whatever you call it, and cut your meal in half and put half away. And you don't have to finish the whole meal.
Exactly.
You know, when we were young, and I was with some people this weekend, some older ladies that were up in age, and they just believe you have to clean the plate. So everything that's on the plate has to disappear.
Mhm.
But that's not a good practice.
Exactly.
Because
Mhm.
most times, especially in restaurants, you're given too much food.
Mhm.
So,
Mhm.
but we want to talk a little bit about these natural modalities and natural things that can help complement and help us if we're in the pre-diabetic stage to prevent, but can also help us to lower our A1C and lower our diabetic numbers.
Mhm.
You know, an A1C over 6 is not good.
Exactly.
You know, we want the A1C to be down close as we can to 5.8, but not 6, 7, 8, or 9 or higher.
Exactly.
So let me just tell you a little bit about Micro Daily. So Micro Daily is a micronutrition, and it's a micronutrient antioxidant that is very good for the body. And one of the things that I love about Micro Daily is that first it has vitamin A, vitamin C, vitamin D, 2 forms of vitamin E, vitamin B1, B2, B3, B6, folic acid, vitamin B12, biotin, calcium, magnesium, zinc, selenium, and chromium. And you mentioned how important those are when it comes to diabetes. It helps to increase mental focus, heighten our natural energy, give us greater flexibility, greater well-being, help with sleep. And this is really just food. You know, we can just consider it as food. It's just natural. And the great thing about it is out of the design that Dr. Prasad used to come up with Micro Daily, it's in the right form, the right quantity,
Exactly.
and the right composition. It is proven, has a patent to be a micronutrient formulation for treatment of diabetes type 2. So it has a patent that was issued in 2009. Another thing that I saw here that was very surprising is that evaluation of the effects of micronutrients in the combination with standard therapy in the management of type 2. So it's a very good complement to what we're doing. And then lastly, they did some studies out of Walter Reed Military Hospital, which is in Washington, D.C., with diabetes, over 7 million studies that they did with people with micronutrients, Micro Daily, and diabetes. So, how can we win with diabetes?
Micro Daily is great. Is great in pre-diabetic people and in diabetic people. As I told you, in pre-diabetic people, Micro Daily and controlling your diet and reducing your weight may be sufficient with all other natural products to control your state and don't develop diabetes and don't be in need to any chemical medications.
Right.
In diabetic people, 200, more than 200, or even 300 or 400, they will need classical chemical oral medication. Okay? But as the clinical trials say, that using micronutrient, even in diabetic people more than 200 or 300, it helps a lot to control diabetes.
Right.
It helps a lot to prevent the complications also, because Micro Daily is, as you said, combination of vitamins and minerals like selenium, calcium, all this kind of stuff in a proper quantities. And this is the magic pill for this. It's standard quantity, which is useful for the patient and to target the cell effectively and efficiently. Because on the shelf in the store, there are vitamin D, there are vitamin A, but what quantity to take?
Right.
Because vitamin A, for example, vitamin D, are very useful for our body. But if we take it with high doses, it may damage the liver, for example.
Right.
It's not good. The magic concerning micro daily is that the quantities is well adjusted and adapted to be useful to our body in all aspects. Of course, the dose may be different from a patient to another. Usually we start with a little dose and then we follow up the patient, and we may increase the dose to the maximum that cannot hurt and can be very beneficial for people. But I recommend micro daily because it contains all the natural product and vitamins and minerals that we need in a proper quantities.
Yes, and you said something while we were on break or earlier about it helps with circulation.
Sure, and what's the meaning of this? The meaning is that it prevents complications of diabetes.
Right.
Not just helping to control diabetes, but prevent complication. Because one of the famous complications of diabetes is that we have ulcer. Why does this ulcer happen? Because poor circulation in our extremities.
Yes.
And micro daily increase circulation and prevent it to happen.
And that's what I was going to say. Sometimes people don't understand that uncontrolled diabetes leads to stroke,
exactly.
Leads to amputation of limbs, leads to non-healing wounds.
Mm-hmm.
And like you said, this helps with circulation, so it helps some of the complications that can result from diabetes.
Exactly.
And it's very hard to sit back and watch our loved ones not be in well condition from something that is very preventable.
Exactly. And also micro daily not only improve circulation and prevent ulcers in diabetic patients, it also help regeneration of cells.
Regeneration
of cells, yeah. And the importance of this is that when regeneration happens, this may decrease the chance of that organs fail or get in trouble. While regeneration of the cell, you decrease the chance to have problem in our retina, in kidney, affecting the heart, and having a stroke in the brain, for example. So micro daily is very useful in controlling all kind of complication, even if in some cases do not control good the reading of the blood sugar. But most of the time it controls the blood sugar reading with the chemical medications, as long as we have sugar more than 200. Less than 200, as I said, we don't need most of the time chemical medication. But even if you have a high blood sugar and we need taking chemical medication and we take micro daily help to control diabetes. And even if cannot help the reading of blood sugar, it prevents the complications because it increases circulation, improve our immunity, and regenerates the cell and prevents the damage of our brain, our heart, and our kidney, and our retina.
So you said it improves our immunity.
Mm-hmm.
Helps the regeneration of cells. And you kind of got excited, so I don't know if you saw I was getting excited. I love talking about cells because our bodies are made of cells. Our bodies are not made of hearts and livers and kidneys and pancreas. So from what I'm hearing with micro daily, it helps regeneration of cells. It helps circulation. It helps build our immune system. It helps our body create glutathione, which is excellent master antioxidant for our bodies. So it is a wonderful micronutrition that we can take on a daily basis. I guess that's why they called it micro daily.
Exactly.
If we take it daily, it can help with preventing complications. And some of the complications, a lot of people with diabetes really don't understand that when you get diabetes or you're a pre-diabetic and you have the two other amigos because of the high blood pressure. A lot of times you have a diabetic that has an uncontrolled blood pressure. And typically if you get the blood sugar in line, the blood pressure will get in line.
Exactly.
You have high cholesterol. And when you have those three, that's why you have an increased risk of stroke.
Exactly.
No one wakes up to a stroke. No one wakes up to some of these conditions. But if we don't take care of our bodies and we don't take care of our stress, we don't take care of eating better and what we put in our mouth, then we are on that journey. And when you're on that journey of diabetes and you don't control any of that, and you deal with blood sugars of 400, you have poor vision.
Sure.
You have the ability to have sores and ulcers develop on your legs.
Sure.
Poor circulation. So we don't want to get to the state to where we have those complications. Now, I love essential oils. You know that.
Sure,
I
I
love
them too.
So I know that there's some really good oils that can help with stress. Number one, always they can help with stress and with our emotions, but also with our blood sugar.
Sure.
So, and even natural herbs, right, that we can take.
Yeah, yeah.
That can help decrease our blood sugar. You know, vinegar, drinking good water. You know, so what's some other natural things that we can do to help complement and help lower that diabetic, our blood sugar?
There are many things concerning essential oils. They are very, very useful in controlling diabetes and even controlling their complications, like the microdaily. For example, lavender oil, peppermint, eucalyptus, bergamot, all these kind of essential oils that we can inhale. It can control diabetes. How? What is the mechanism? As I said in the beginning, that stress and obesity make you liable to type 2 diabetes mellitus and increase the conditions that we call insulin resistance.
Yes.
The pancreas secrete insulin, but the insulin cannot work on the cell, and the cell resists the insulin. One of the causes of this, or many causes like obesity or stress. Essential oils control obesity and control stress. And through this mechanism, they can control diabetes. For example, essential oil can decrease cortisol level that I told you before, the hormone that while it's increased, it can make you tense and nervous and anxious and stressful, and this may make you prone to diabetes and to its complication even.
Yes.
Essential oil controls this. Essential oil controls circulation, so it can prevent the complication for having ulcers or something like that.
Right.
Essential oils also, like microdaily, but I forgot to say that, control a process called oxidative stress.
Yes.
Which is a stress that from our side effect of drugs, pollutions, all this kind of stuff, we have called a free radical, a single atom oxygen. I don't want to speak scientifically a lot, but this kind of free radical damages the tissue.
Yes.
Through a process called oxidative stress. And microdaily and essential oils can combat this stress, oxidative stress. So increase regeneration of cells, improve circulation, and all this kind of stuff can control diabetes and prevent its complications. And by the way, I want to say something. There is a research that I did not do it, but I read it in the literature, that diabetic people can have, I didn't say that in complication, may have increased risk to have cancer, by the way.
Wow.
This is through oxidative stress.
So we got to rewind that. We have to rewind that. That was a pretty powerful
and essential
statement.
oils can prevent diabetic people to have also cancer.
Wow.
Yeah.
Wow. So if I was, let me rewind and see if I got all that. So a diabetic person, because of free radicals, which free radicals are those unhappy elements in our body that are just like narcissistic, they're aggressive, looking to hold on to something that causes oxidative stress.
Okay.
And with oxidative stress and with the diagnosis of diabetes, that can cause you to be more predisposed to cancer.
Exactly.
Because cancer,
especially liver cancer.
Yes, because cancer is a disease of where our cells, oxidative stress, inflammation, and so if we use microdaily and essential oils and we do some of these preventative things, we can prevent even getting down the road to that step.
Exactly. So as you can see, complications of diabetes are, as I said in the beginning, horrible.
Yes.
And controlling diabetes and trying to prevent its complication is very important. It's a must. It's not a joke. So don't take diabetes lightly, because if you take it lightly, it will kill you.
That's
but
true.
If we take it seriously, with very few regulation and standard and natural products, we can win our battle with diabetes.
That's right. And that's what we want to do. We want to win.
Exactly.
Because, I must say, Micro Daily, if you take the powder, it tastes like lemonade. Those of us that have gotten sugar out of our diet, it may seem a little sweet, but on the level of the micronutrients and how it prevents the complications, regenerating our cells, giving us, helping our body to create glutathione, helping to build the circulation, helping to improve our heart, helping to decrease cardiovascular. And I didn't mention some other things that Micro Daily does, just a number of things that it can help with our hearing, our heart health.
Sure.
And, like we said, diabetes comes with those two friends.
Hypertension and dyslipidemia. Yeah.
Yes, and cholesterol.
And by the way, I want to say that when you are diabetic, you should be more meticulous in controlling your blood pressure and lipid. You can consider blood pressure 135/85 normal. But when you are diabetic, your blood pressure should not be more than 130/80.
Okay, so we got to keep it down.
Yeah.
So we have some people who their blood pressure is higher.
Yeah.
I talked to a lady the other day, and I don't even want to say her number because you might fall out of your chair. But this is a serious situation that we got to take control of.
Sure.
And like you said, we can win. So tomorrow, you're having an informational meeting from 5:30 to 7 at 4550 Heaton Road. And people can come on Tuesdays in the evening and talk with you and get more information on how they can win the battle with diabetes, blood pressure, and how we can complement. That's what I like to say.
Yeah, exactly.
They're complements, like the nurse to the doctor.
Exactly.
Right? A nurse complements a doctor because they work together. And together, there is a saying that nurses save lives. Have you ever heard that?
Yeah.
Okay. We try not to take all the credit, but, it's true that doctors and nurses work together and complement each other to come up with a great care for the client. Natural products, Micro Daily, essential oils, decreasing our stress, exercising. And the weather's getting good. Now, we're supposed to have some snow here in the next 2 days, but we are at the end of March, so we're getting ready to turn a corner here in April, which sometimes that doesn't mean much in Columbus, Ohio. But hopefully we get some good weather that we can get out and we can do some exercise. We can walk, get some natural vitamin D.
Sure.
So, anything else? How else can people get a hold of you?
I think you said all that I want to say, but I want to say that we should work as a team.
Yes.
Not doctor and nurse, but doctor, nurse, and patient.
Yes.
People should want to help themselves. We cannot help them unless they want to help themselves. As long as they want to help themselves, we can help them by working as a team, and all of us gonna win the battle.
Yes, we will win the battle. Choose wellness. Choose life.
Thank you.